Morning, how are you today?
Thank you. We're doing
We're
well.
very well.
Glad to
Thank
have
you,
you
Doc.
with us here on the program since we are commemorating World Cancer Day. Before we get into a more deep dive into our discussion, could you explain the difference between what is colorectal cancer? I mean, I've heard of colon cancer.
Yes.
I've heard of rectal cancer, but what is colorectal cancer?
Yeah, actually, the colorectal cancer is a colon cancer.
Okay.
Yeah, because you know that the rectal is part of a colon. Colon
Okay.
is a large bowel.
Yes.
Okay.
Right.
So rectal is part of a colon.
Okay.
But the problem is around 1/3 of a tumor or cancer in rectal area. So that's why sometimes we must make stress colorectal cancer.
Okay, it's more specific then. Okay.
Now, Prof,
Yes, more specific.
throughout the data, what has been the reasoning of the spike of colorectal cancer, especially right here in this country?
Yeah, so you know, because I mentioned that this disease correlated with the lifestyle, okay, bad lifestyle, like increase the body weight, obesity, lack of activity, you know, and also take high fat diet, and then take the low fiber diet or something like that. So this is the problem, and also smoking and alcohol as well, consumption.
Really?
This is what we call that the risk factor of colorectal cancer. So there's the problems, our problems, because because this disease correlated with the lifestyle.
Okay, Professor, so what are some of the early signs or symptoms, perhaps, of colorectal cancer? And what can we do once we start seeing some of these signs? What are some of the first steps we should be taking?
Yeah, there's the problems of the disease, because you know that the colorectal cancer, or we call that colon cancer, don't always cause symptoms. This is the problems, especially at first. Because sometimes, actually we have a polyps or small colorectal cancer, but we don't know it. Yeah, that's why we need to, what we call that, the screen regularly for colorectal cancer. Yes, but sometimes patients come with rectal bleeding, you know.
Yes.
Sometimes patients mention that what we call the change in bowel habits, like diarrhea, sometimes constipation, and sometimes patients feel pain, and then sometimes lose body weight. But again, I mentioned that these patients sometimes come without these symptoms.
There's no symptoms at all.
The problem.
Right.
Okay, so that's difficult,
Yes,
if you don't
like
even
to
know
figure out.
Right.
Now, Professor, is, let's say, having a stomach ache or a severe stomach ache that continuously happened to you, could that be one of the earlier symptoms too, Professor? Even though you said, you know, it's differ for each person's self. Okay, so as of right now, as you're seeing, oh, you're back, Professor. Yes.
Yeah, sorry about that. Okay.
It's okay.
Okay, please. Yes. Would you like to repeat the question, please?
Yes, Prof, could one of the symptoms be a severe stomach ache that is continuously happens to, let's say, one person? Could that be one of the earlier signs also for colorectal cancer, Professor?
Sorry, would you like to repeat again? I cannot hear your sound.
Yes,
please.
Prof, it's okay. For someone that has a severe stomach ache, let's say, that goes on continuously, could that be one of the symptoms too, Professor?
Yeah, actually, what we call that, the location of pain, we must know that the location of the pain first.
Correct.
Because if the patient feel epigastric pain, so maybe this due to from gastritis or dyspepsia or stomach ache or something like that.
Right.
But if the patient feel pain, what we call that below belly button, you know, belly button, okay. So maybe the cause of the pain from colon, okay. So that's why, I mean, if a patient have abdominal pain, they must come to a doctor to make sure what is really what is the location of the pain, and then what the cause of the pain. So this is important.
Okay, yeah, Professor, we do know that treatments for cancer, there are various treatments for it. Is it the same for colon cancer, depending on how severe or how far along the cancer is, then you decide what the treatment would be? And what are some of the treatments available to those that are suffering from this?
Yes, so that's right. So I think we treat the patient, it depends what is the staging when the patient come to us.
Okay.
Hope so, when we make a screen that the patient only like a polyps, okay, like the polyps, small polyps. So if only polyps, by endoscopy, we can cutting the polyps.
Okay.
So mean that we stop the growth of the polyp to be a cancer in the future. Okay. And then if the patient have a growth to be a cancer, so it depends the staging. Staging means the what is the big of the tumor, okay? And then what the involve of what we call that lymph node or involve the other organs. Staging 4, if that the disease have involved liver or something like that, okay? What we call the metastasis.
Okay.
So first, if the patient come with the stage 1 or stage 2, the doctor will what we call that resections, okay? To resections, and then the patients need chemotherapy after that.
Chemo, okay.
And I give information that as early case come to us, it is easy to us to overcome this disease. So what we call that the survival rate of the patient. I mean, the patients come with the staging 1, so the survival rate for this patient above 90%.
Oh, okay.
90% years mean that the patient still alive after around 90% of the patient still alive after 5 years. Okay?
Yes.
Okay.
But if patients come with us with the staging 4, what we call the advance of the disease, advance of the cancer, maybe only 12% of this patient is still alive for 5 years.
Okay.
5 years.
So much like every other cancer, early detection is very key to this.
Yeah, that's right. We call that early detection is important here.
Okay.
Now, just adding to what Paul has stated, that this is somewhat is the same like other cancer, is colorectal cancer cells can also affect other body parts and triggers other forms of cancer, Professor.
Yes, as I mentioned that if the condition of the patient with stage 4,
correct,
maybe we can find this cancer in liver, maybe, or in the lung. So that's why if what we call that the advance of the cancer.
All right. So early detection is needed.
By the way, we do have our colleague with some questions as well. Before we go to her, though, what is the screening process exactly, Prof? When you say somebody gets themselves screened, what is that process?
Yes. I mean the screen. First, we can check from your stool, okay?
Okay.
And the stool, if there is what we call that the blood inside the stool,
yes,
maybe the patients in the stool is still normal, but with the laboratory, from laboratory, we can find if there is a blood or not, okay? And then we can check what we call that the marker for colorectal cancer, take a blood, okay? And then we can perform the colonoscopy, okay? Colonoscopy.
All right.
So for a patient with the risk factor, like their parents have colorectal cancer before, or patients with the risk factor I mentioned about the obesity, smoking, alcohol consumption, and also maybe with the history of high fat diet, something like that. So patient with the risk factor, and also if the age above 60 years old. So I think we recommend for this patient to screen for colorectal cancer.
Okay, so those are the higher risk groups. Now, I believe we have our colleague Shanaz who's going to jump in here. She's got a few questions for you as well, Professor. Shanaz?
All right, Paul, thank you so much. So I have some questions that might be clarified by Professor Ari. So the first question, can certain medicine, like for example diet pills, Professor, trigger colorectal cancer?
Yes, until now we don't have any data about this statement, so don't worry about that.
Don't worry about this. Okay.
But go ahead and take your diet. The problem is the obesity. Obesity is a risk factor. So maybe this patient ate some pills to reduce the obesity. But actually, the obesity is a risk factor for the colorectal.
Right. They're connected.
All right.
Before they take pills.
All right. So not the diet pills, right? All right.
Yes.
The second question would be: is bloating a sign of colorectal cancer? Bloating.
Yes, I think bloating. I mean, yes, and I know. You know that the tumor will increase large and large, okay, and then they will block our lumen, our colon lumen, okay.
Okay.
If they block, maybe the patient will find, a bloating, pain. So in these conditions, maybe the cancer have advanced cancer because you know the tumor have blocked the lumen.
I see. So it made them a little more gastric, like that, sort of like that, Professor. All right.
Yeah, that's right. But anyway, if you have any symptoms, discomfort, please come to a doctor to make sure if there is correlated with cancer or not.
All right. All right, and we move on to our third question. Is losing weight for unknown reasons a sign of colorectal cancer?
Yes, that's right. I mentioned that one of symptoms of colorectal cancer is loss of body weight. So,
loss of body weight.
Okay, be careful if you have, what we call that diarrhea or constipation or abdominal pain or rectal pain with losing of body weight. Okay, so you must be careful. Maybe it's correlated with the cancer.
All right. Thank you so much, Professor, for enlightening us with your answers. Now back to you, Carol and Paul.
Thanks, Shanaz.
So much,
Professor, I've got a quick question in regards to, we know that when it comes to cancer, someone can be cured of cancer, but may not be permanent. In fact, several cancers have been known to be able to relapse. Is it the same thing with colorectal cancer as well?
Yes, of course. I mean, so for cancer, for every cancer, we call that remissions or relapse.
Remission, right. Okay.
So so that's why for this disease, they will relapse as well in the future if the patient don't control to a doctor.
Now,
regularly.
Professor, just before we conclude our discussion for today, I mean, one of the factors that you were saying, one of the risk factors was hereditary. So I want to, redline on that. Some people, maybe having parents that has colorectal cancer might adopt having themselves colorectal cancer and maybe it could ignite because of the lifestyle. So can you please elaborate a little bit more about that, Professor?
Yeah, so why? Because you know that many data mention that this disease correlated with the lifestyle. Okay, actually the good thing is we can go to the toilet every day. Okay, so if and then the problems for what we call that constipation because of lack of drink water, and then lack of activity, lack of exercise, and then lack of fiber diet.
Yes.
Okay. So they make the stool keep in your colon. So maybe in the future they will make what we call that inflammation, and then polyps, and then cancer in the future. Okay. This is one of hypotheses why we must care about the diet itself.
Yeah, most definitely.
And the important thing, genetic is one of risk factor as well.
Yeah, so it's important for you to see what you put inside your mouth, right? Because it goes to your colon and whatnot.
Yeah, that's right.
And you know, it's really preventing, hopefully that also prevents for you to get a colorectal cancer.
Basically, much like everything else that's health related, just eat healthy and make sure that you eat a balanced lifestyle and stay hydrated. Doc, it's been great and very insightful talking to you. Thank you so much, Professor, for your time. We really do appreciate it. And again, as we commemorate World Cancer Day, we hope we can get those cancer numbers here in Indonesia down to a lower number as well. Have yourself a great weekend,
Thank you very much, Professor. Stay safe.
Thank you very much.